In Singapore, we have so far observed mild disease in local cases aged under 12 years, even with the Delta variant. We are also fortunate thus far that our children under 12 years old who have been infected, none of them has required ICU nor oxygen. To keep our children safe in the school environment, we implement stringent safe management and surveillance measures and have adjusted the conduct of school activities where necessary. All staff in schools and preschools are required to wear masks. Students in school are also required to wear masks, while in preschool, either masks or face shields are strongly encouraged for children above the age of 2. For masked-off activities in schools, extra safe management measures are taken. Mask-off activities are currently suspended in preschools. Preschools and schools also emphasize good personal hygiene and social responsibility. Staff in preschool and schools are also prioritized for vaccination. These measures collectively mitigate the risk of infection in our students. The Expert Committee on COVID-19 Vaccination, or EC19V as we call it, is monitoring ongoing vaccination trials for children under the age of 12. The EC19V will assess if it's suitable to administer these vaccines to children under the age of 12 and make recommendations to MOH at the appropriate time. Ultimately, managing COVID-19, whether nationally or in our school setting, is about managing risks and balancing trade-offs. Over time, we have developed a better understanding of the virus and how to live with it in our daily lives. As we move towards a new normal of COVID-19 as an endemic disease, we are making a conscious move to adopt an appropriate risk management strategy and collectively determine what level of risk is acceptable to us as a society. The past few months have given us more confidence that we can strike a better balance by taking a more targeted approach to ring-fence cases and their close contacts. This has allowed us to isolate affected students and staff and not close all primary schools where most students are not yet eligible for vaccination. The alternative to full home-based learning on a prolonged basis comes at a cost to the learning and especially the social-emotional development of our young. And it takes a toll on the mental wellness, place additional stress on educators, parents, and students, especially when not all students have home environments that are conducive for home-based learning. The negative impact falls disproportionately also on the lower income families. We will continue to fine-tune how we manage school cases and ensure its sustainability as we transit towards living with COVID-19 as an endemic disease. Taking reference from the national posture and working closely with parents, we will continue to work hard to keep our schools and students safe.
A lot of parents have come to me and said they're very worried about the health and safety of their children, especially those under the age of 12 who are unable to get vaccinated at the moment. So I just wanted to say what efforts are being made to address these concerns, efforts to address directly to these parents, because obviously a lot of them are very worried. A lot of them are writing to me, writing to all of us here. They want to know, how about those parents, for example, with children who have pre-existing conditions or pre-existing medical conditions that make these children more vulnerable if they actually do get COVID-19? Are these children expected to isolate or stay at home? And what are the actual effects this will actually have on these children? Especially at the preschool or maybe even infant care level. As many parents of young children will know, it's actually very difficult for these children to keep masks on and adhere to hygiene and safe distancing measures. What sort of extra steps and precautions are taken to make sure that these children, and also by definition that they are family members, especially vulnerable family members at home, are also protected.
Now, having said that, what we need to do is to make sure that we put in place the safe management measures for our children to live their life as normally as possible so that they can continue to grow up and continue learning as much as possible. And we need to do this in a sustainable way. Bearing this in mind, we need sustainable solutions in order to allow our children, especially those below the age of 12, to continue learning and growing in as normal an environment as possible. We want to make sure that we observe all the safe management measures that we can practice, personal hygiene, cohorting of the classes to minimize the chances of our younger children getting it. And I think to this extent, the adults also have a role to play, which is why we encourage everyone to try to get vaccinated as soon as possible. Now, having said that, it doesn't mean that those people who are vaccinated are no longer going to transmit or be carriers of the virus. But what it does means is that the chances are reduced and the symptoms are much less. That is also one way to keep our younger children safe. Make sure that we organize our activities in such a way that can allow our children to interact, to learn in a group, but not having too many of them mixing around and just in case anything happens, which means that we have tight cohorting in the schools, in the preschools, to minimize the chances of this happening. Upon the detection of any of the cases, quickly ring-fence the affected parties so that we can minimize the chances of this spreading to the rest. And this is where parents can also play a part to work with the schools and the preschools to keep our children safe. If, for whatever reasons, a member of the family is ill, please do not send the children to school until we have verified that the children or the family will not pose a risk to the rest of the other students in the school. So I think collectively we can all do that. Now, going forward, if and when the day comes whereby we have other testing capabilities that are less intrusive, that we can conduct on a mass scale, that will allow us yet another tool for us to see how we can safely have more activities by testing more people more regularly, including perhaps the younger ones. But at this point in time, we do not yet have that less intrusive testing capability for the younger ones. So we have to continue to work together to make sure that we keep our children and our schools safe. We can do certain things in the short term, but we can scale up certain measures. But the question is, how do we make such measures sustainable, bearing in mind the interests of the children, the families, and also the educators, which was what I explained to the public last Friday. We all understand it's harder for the children of the younger ages to keep their masks on, and it will take extra effort for us to make sure that we apply the safe management measures, keeping their personal hygiene good, and at the same time cohorting them to minimize the chances of transmission in case one of them should be infected with this. It's very important for everyone again to work together so that a child who is sick or a child who is from a family who has someone ill and not verified yet, to avoid sending the child to the school or the preschool so that we minimize the chances of this spreading to the rest of the other people.